holidays are almost here, and it's a great time to review some basics about controlling your blood sugar before you enjoy some holiday treats. Having good control is important for everyone, especially patients that have been diagnosed with diabetes. Blood sugar is raised by glucose, which is a sugar from many types of foods that contain carbohydrates. A normal blood sugar is not strictly reliant on how many carbs and added sugars you eat. Other factors can play a role. So, what can you do to avoid dangerous blood sugar swings and prevent or lower your symptoms of diabetes? I'll tell you. What you eat is the single most influential factor when it comes to your blood sugar levels. It is so important that you eat a balanced diet, low in processed food. The foods we eat fall into 3 categories: proteins, fats, and carbohydrates. All carbohydrates and proteins, to a small extent, affect our blood sugar by turning into glucose. It's not just sweets you have to worry about, though. High-carb foods include breads, pastas, fruits, and starchy vegetables like potatoes or corn. You really should try to eat a source of protein, fiber, and healthy fat with all of your meals. Some great examples of protein sources include wild fish, free-range eggs, grass-fed beef, and raw dairy products like yogurt or kefir. Healthy fats include coconut oil, extra virgin olive oil, nuts and seeds, and avocados. And high-fiber foods include fresh vegetables, whole pieces of fruit, beans, or ancient grains. Lastly, it's important to pay close attention to added sugars in foods, as these can have a big impact on your blood glucose levels. You'll want to pass on foods made with refined or enriched flour and added sugars like high fructose corn syrup or cane sugar. Instead, opt for natural sweeteners like raw honey, stevia, or pure maple syrup. Another big pitfall in poor blood sugar management is with beverages. It's best to stick with water, seltzer, herbal tea, black tea, or black coffee, and avoid fruit juices and soda. Next, you'll have to get regular exercise. Just 30 to 60 minutes of exercise most days of the week is a simple way to lower inflammation, manage stress, improve your immunity, and balance your hormones. Walking, biking, hiking, running, swimming, weight training, or yoga are all fantastic options. Regular exercise helps to increase insulin sensitivity so your cells are better able to use any insulin available in the body. Lastly, it's important to manage the body's other important hormones by reducing stress and getting enough sleep. Excess stress can raise blood sugar levels due to an increased release of our stress hormone called cortisol. This can lead to a vicious hormonal cycle by raising blood sugar, increasing cravings for comfort foods, which are usually filled with sugar and other inflammatory ingredients, and usually interfere with getting good quality sleep. How do you know if you're not successfully managing your blood sugar levels throughout the day? Some common signs and symptoms not to ignore that can signify diabetes and fluctuating blood sugar levels include chronic fatigue, sugar and carb cravings, excessive thirst, weight fluctuations, and mood swings, along with increased urination, blurry vision, slow healing of skin wounds, or frequent infections. As the holiday season gets closer, pay attention to what and how much you're eating. Remember, it's not just grandma's famous sweet potato casserole or peppermint lattes that'll affect your blood sugar. It's also the stress and anxiety we can feel trying to buy the perfect gift for all of our extended family, keep the house in Instagram-worthy condition, and burning the candle at both ends, sacrificing sleep to get it all done. Call for an appointment with one of our medical providers to see how well you are taking control of your blood sugar. Stay well and happy holidays.